It is Saturday, November 13th, 2021. And guess what? This is your health day. Hi, I'm Carl H. Tutt Jr., Board Chairman for 100 Black Men of Chicago. And I'd like to welcome you to our 2021 virtual National Health Expo that we're going to be presenting to you this morning. This is going to be a great day for you. This is an opportunity for you to learn, an opportunity for you to share, ask your questions, and don't just leave this session holding on to that information. We want you to share it with family, share it with friends, ask questions for your family and friends. We have a great platform of meetings, discussion, and we even have an expo where you can go and listen to other information that may be critical to your health needs. So please enjoy this morning. Get your notepads out. Get ready for some great information, some great speakers, some great panel discussions. And I promise you, you will not be disappointed. But I want to tell you, we don't do this alone. Our co-sponsor for this event is 100 Black Men of America. And they have been a wealth of information and support for us to be able to do this event this morning. And to be able to talk about that for a moment and welcome you as well is our national chairman, Thomas W. Doyce Jr. And so we want to welcome him to the stage. Tommy?
Well, Carl, let me start by saying thank you. Your leadership has been phenomenal over the years. The 100 Black Men of Chicago continues to address all of the for the future issues of the 100 Black Men of America. So I want to say thank you for your leadership. Even when we did the blood drive, you were the first one in line to give blood when we did the partnership with the American Red Cross. This is very important, and this day is important for us to focus on our health as we deal with mental health, and we look at the challenges of youth violence, and we look at diseases, and of course, COVID-19. Today is going to be a day for us to share information, a wealth of information. And I must say thank you to Dr. Michael McGee, who has been a phenomenal leader. He heads up the Special Violence Prevention Task Force for the 100 Black Men of America, and of course, for the 100 Black Men of Chicago. He, along with Dr. Mark Alexander and a host of many accomplished health professionals, are working for us to make sure our communities are safe, that they are healthy. As we say to the business owners, what good is wealth without your health? And so we're trying to make sure that we have a healthier community dealing with so many health disparities. While COVID-19 is before us now, we were dealing with health disparities before, and we've seen the impact that this COVID-19, this pandemic has had on those with health disparities. And so for all of you joining in, for the young people, for the parents, and for the community leaders, and for our elected officials and policymakers, thank you for partnering with all of us. And thank you for making sure that we're looking out for the health of our communities. This Health Expo is phenomenal. This chapter that we're partnering with, Chicago chapter, has been at the forefront of all of the major issues that give us better quality of life. And so today, let me thank all of the members of the 100 Black Men of Chicago. I thank our world headquarters staff, and thank our Health and Wellness Committee and all of the presidents and members who are tuning in. It's important for us to stay focused, and it's also important for us to understand we can't expect others to do for us the things we can and must do for ourselves. Have an enjoyable conference. Look at the information we're sharing, and more importantly, take the future of your health into your own hands. So Carl, thank you. And to the brothers of the 100 Black Men of Chicago, thank you. We're here, we're real men, given real time. I guess I get to be the star a little bit longer this morning, huh?
Yeah, Chairman Dortch, if you can do me a favor, we're trying to get Dr. Miller online. It's 9:10. We got a little bit of time. So I'm going to hop off. If you could really talk about the story of how the 100 Black Men of America started. I know you would, that would be awesome. If you could take 3 to 5 minutes to do that, I would appreciate it. And I'm going to try to get Dr. Miller and Congresswoman Kelly engaged. All right. Thanks. All right.
Well, I'm back with you this morning. I'm enjoying this. Maybe I can get me a second job out here trying to work as we broadcast. But let me share with you while we're waiting for the rest of the team to sign on. Let me just share with you a little information about the 100 Black Men and who we are. Our first chapter started in 1963 in New York with some of the phenomenal icons of our nation. The former Mayor David Dinkins, who we lost last year, and of course, Jackie Robinson, Edison Wingate, Dr. Haling, Dr. William Haling, Nate Golston. They came together in New York in 1963 to address many of the challenges we see today throughout this country as they looked at the problem of police brutality and the policies that did not allow Black police officers to arrest white citizens unless they were accompanied by a white police officer. So in 1963, these phenomenal men decided enough was enough. And so they came together, they addressed and changed the policies in the public safety department in New York, and they looked at other issues and took on those issues in the city of New York to make, again, quality of life better for the Black and African-American citizens. And so at the end of 1963, the question came, do we stay together? And it was unanimous that they would stay together. And then after that, a question came from the membership, well, what shall we call ourselves? And David Dinkins said, we will call ourselves who we are, 100 Black Men. It was a total of 100 Black men. Today, thousands in this organization, great men committed to making a difference. And so in 1963, we came with the first chapter, 100 Black Men, Inc. The next chapter was the Newark, New Jersey chapter that was chartered by Dr. William Haling. And then the Los Angeles chapter, chartered by Dr. William Haling. And in 1986, with a total of 8 chapters that came together, we formed 100 Black Men of America Incorporated. Today, there are more than 104 chapters of 100 Black Men of America. And in 1994, we adopted a slogan that says, what they see is what they'll be. And that's the truth. Our young people, they emulate what they see in adults. Our young people aren't born bad. They learn bad behaviors from adults. And so as a result of that, we launched an effort throughout this nation. One, our first founding president was Dr. William Haling. Then after him was Nathaniel Golston, a phenomenal business owner, entrepreneur. And again, these were 2 of the founding members of 100 Black Men of New York, Inc. And then after that, I served as the 3rd head of this great organization. Then Al Dotson followed. And then, of course, Curly Dossman followed. And then I'm back now as the chair again. But the success of this organization is not about me. It's not about the national offices. It's about the great work that's done in our chapters throughout the country. What we have is for the future. Everything that we do must fall in education, mentoring, health and wellness, and economic empowerment. And we have an overlay of development because leadership is important in everything that we do. This organization has been involved in mentoring young people. We currently have over 125,000 young people in our mentoring. And as we face this dreadful pandemic, we have worked with many organizations. We worked with Walmart. We worked with Walgreens. We worked with, again, Pfizer, and we're working with Apple, and we're working with so many different companies trying to address the pandemic. And so we were involved in helping to get more African Americans in the clinical trials. And we worked to get more young people in the clinical trials as Pfizer was trying to make sure this vaccine would work for younger people. I got both of my vaccine shots in January, and 3 weeks ago, I went to get the booster. Let me encourage all of you in the sound of my voice to get the vaccine. We have to stop the spread of this dreaded disease. And also, it's important to understand that it didn't just happen in a few months in terms of finding this vaccine. President Obama started an effort back when the SARS infection hit our nation and hit the world, and when we were afraid about Ebola. And so over 10 years ago, they started the research. When the previous president, Trump, came in, he stopped the federal funding, but the private funding did not stop. Again, all of my children have had the vaccine. So many of the members and their families have had the vaccine. We've got to be on the forefront of making sure we have protective communities. If 750,000 people who have died in this country is not enough, think about the millions worldwide. And think about the fact that almost 180 million have had the vaccine, and we're still living and still making a difference. So with that, let me just make sure we can keep things moving. But with the 100, we have the collegiate 100, we have the emerging 100. And for the men who want to dedicate and commit their time and give back to communities, understand we didn't get to where we are by ourselves. We had mentors before they coined it as mentoring. So with that, thank you for all of those who are mentoring, to the ladies who are making a difference. These are partnerships. And so I'm going to move on. Thank you for joining us today. Enjoy the conference.
Thank you, Chairman George, for ad-libbing. We have Dr. Miller and Congresswoman Kelly. They've joined us. And I appreciate you. And we're going to continue with the opening session. Thank you.
Marvelous. Thank you for joining us today. Enjoy the conference.
Thank you, Chairman George, for ad-libbing. We have... All right, so Dr. Miller, so you are, we have Dr. Yvette Miller from Red Cross. I'll let you take it away and give remarks.
Great. Thank you so much. I really appreciate the opportunity to share some information today. And thank you so much. And I bring greetings from the American Red Cross as the Executive Medical Officer. And so thank you, Dr. McGee and the 100 Black Men of Chicago, for this invitation to share some thoughts this morning. The theme to this event says it all. Our people, our power, think globally, act locally. How individual action leads to collective impact. This is what blood donation is all about. Individuals donating blood to save lives, and specifically, Blacks donating blood to save Black lives. Certainly in the Black community, as Chairman Dortch mentioned, and in communities of color, we are all too well familiar with the many health disparities and health inequities that affect our people. But one group of individuals that desperately needs our help are patients with sickle cell disease, a lifelong condition that affects the red blood cells. In this country, over 100,000 people, mostly who are Black or of African descent, need blood to treat this condition. As Blacks, we have some unique characteristics to our red blood cells that can make it critically important to match between the donor and the patient. In addition to meeting the needs of these patients, there's a constant need every day for blood to treat trauma patients, people who are being treated for cancer, and mothers that are bleeding after surgery. We are also experiencing an unprecedented shortage of blood in this country right now. Again, has already been mentioned due to the challenges of COVID and the Black community and communities of color being disproportionately affected by COVID. the number of folks that come out to donate have decreased significantly. And then, of course, there have been so many other challenges. So my call to action to you is, please step into this space, roll up your sleeves, and donate blood. You can do this by calling 1-800-RED-CROSS, going to the Red Cross Blood site, redcrossblood.org, and downloading the Red Cross Blood Donor app. And make that appointment today. And just as important as making the appointment is keeping that appointment. So again, I kept my remarks short because of some of the technical difficulties. But again, thank you so much, 100 Black Men, for allowing me to share this information and giving this call to action to roll up your sleeves and donate blood and keep that appointment. So thank you so much, Chairman Tutt.
Thank you, Dr. Miller. And we embrace that call to action that you just put out there. As 100 Black Men in Chicago, we participated in our blood drive in September, as well as other 100 chapters around the country. And we're going to be continuing to do that. I think our next one will be early part of March. And so we will be campaigning to get people to come out and to donate blood, bring your families, to participate. We can make this into a family event.
Mm-hmm.
And so we look forward to that.
And let me just say, just one more thing, just thank you so much. I was there, of course, in September for that blood drive. It was an honor to be there. And I, again, thank 100 Black Men so much. And I'm here in Charlotte, North Carolina. So I'm going to be reaching out to the local chapter and getting them involved in having a blood drive. So I'm just as committed as you all are committed. So again, thank you so much for everything that you've done in hosting those blood drives.
And thank you so much. And we appreciate you being here with us today.
Thank you.
All right, our next speaker, and for many people, does not need an introduction. She is dynamic. She is impactful, not just for the state of Illinois, but for this nation. She knows how to get it done. And so we are very pleased and proud that we have our Congresswoman for the state of Illinois, Robin Kelly.
Thank you so much, Chair. Making historic investments in several key areas of healthcare coverage that will
back. So, Eric, is there a possibility we can get her back?
Yeah, I'm a work behind the scenes to get her back. If you can talk about some of the upcoming events we have with the toy drive and the the other things we're doing, and next year, the College Scholarship Fair. It's all fair game, but I'm going to work to get Congresswoman Kelly back.
Okay. All right. While we are working with the technical difficulties to get Congresswoman Robin Kelly back, because we really want to hear her message, it's going to be very important that you hear what she has to say, because she not only speaks for the state of Illinois, she speaks for this country. So while we're waiting for her, we want to encourage people that if you have young people in the grades 7 through 12, please encourage them to be part of our mentoring program. And they can do that as parents. You can do that by going to mentoring, the word mentoring, at 100bmc.org. And Congresswoman Robin Kelly, you're back.
Yes, sorry. I don't know. Technology. It's good when it works.
Technology, it is, and terrible when it doesn't. But we're glad we got you back, and we know you have something important to say to us, and we want to hear it. So please.
Okay. I'm not sure where you stop hearing me, but I'll just start. We're also providing incentives for states like Illinois that have already expanded Medicaid. Hopefully that will help improve the coverage those states are already offering. This bill would strengthen Medicaid and children's health insurance program coverage for parents and children, people returning to their communities from jails and prisons, and people with disabilities and older Americans who need home and community-based services. These policies would narrow racial and ethnic inequities in coverage and access to health services and promote long-term health and well-being among Medicaid enrollees at all stages of life. Another key provision I've been working so hard on is extending Medicaid postpartum coverage from 60 days to 12 months to fight the maternal mortality crisis. Nationally, Black women die from pregnancy and birth-related complications at 3 times the rate of white women. In many states, that rate is even higher. Here in Illinois, it's closer to 6 times higher. We're expanding coverage for seniors. We're going to make sure that Medicaid benefits include hearing coverage. Nearly half of Medicaid beneficiaries report trouble hearing. That is roughly 25 million older Americans. The legislation also invests $150 billion to expand access to quality-based services and care for millions of older adults and people with disabilities. It will also strengthen the direct care workforce by improving provider payment rates and giving the states the resources to improve their care infrastructure. The legislation also makes permanent the Money Follows the Person and the Spousal Impoverishment Program, both successful Medicaid programs that help low-income older adults and individuals with disabilities receive home-based services. The Build Back Better Act will make healthcare more affordable for everyone. This bill will reduce premiums for more than 9 million Americans who buy insurance through the Affordable Care Act marketplace by an average of $600 per year. Another for the city of Chicago is the gun violence prevention investment. According to the GAO, the Government Accountability Office, short-term health costs of gun violence cost more than $1 billion per year. And that doesn't even include physical therapy, counseling, secondary surgeries that gun violence survivors may need down the line. This is a crisis that is disproportionately impacting Black Americans and especially young Black men. Black men make up 6% of our country's population, but more than 50% of gun homicide victims. The Build Back Better Act will invest $2.5 billion for community-based violence intervention initiatives, and these are evidence-based. This will primarily be used for grants to community-based organizations and victim services providers working on the front lines. There is so much to be excited about in this bill, but I will leave it there for today. This bill is going to improve access to care, create more affordable care coverage options, close the healthcare coverage gap, expand benefits for seniors, invest in access to mental health and substance use disorders, invest in addressing the Black maternal mortality crisis, and ultimately save lives. Once this bill is passed, I hope to come back and speak with you soon about all the good coming to Chicago and Illinois. Thank you again for having me today, and I hope you have a fantastic conference. Thank you so much.
Thank you, Congresswoman Kelly. We really appreciate you. You know, you have been a great friend to 100 Black Men of Chicago and being supportive of the programs. I remember when you came out to the blood drive with the American Red Cross. And that was a great opportunity to engage with the community and show your example of leadership for what's needed in the healthcare space. And so we want to encourage you, and we look forward to your continued success for the state of Illinois, and the support and the bills that you're bringing that are impacting this country and that need to be done. And so thank you for all your work.
Well, thank you. And thank you for everything 100 Black Men are doing also. You're an important cog in this wheel. So keep up all of your great works. And thank you.
Will do.
Bye-bye.
Bye-bye. So are we ready to get into the sessions? Are we ready to get into these panel discussions? Are you ready to go to the expo floor and see all the other information that's out there that's just for you and for your family and for your friends? So let's get ready to go.